He was a doctor working in a hospital, and he noticed a weird phenomenon that when women would go in to give birth, the women who saw the expensive doctors, the doctors with lots of experience, had a really high mortality rate, and the women that were too poor for the expensive doctors were surviving just fine. And right, it was completely counterintuitive, and couldn't figure out nobody could figure out what was going on. And so one day he decided to just trail the interns, because that's who the poor women were going to. They were going to the guys who were still becoming a doctor. They weren't actually a doctor yet. And they would go and they'd work on a cadaver, and then afterwards they'd wash their hands, whereas the old doctors who didn't have any training weren't working on cadavers and weren't washing their hands. And that's when Semmelweis went, oh, maybe we should wash our hands. The thing is, that's not the first time that kind of protocol was introduced into a hospital. In ancient Babylon, they had that protocol. There were multiple times in human history where there was some kind of protocol. Hospitals in India 2,000 years ago had a protocol for disinfecting before you would do surgery or before you would treat a patient.